I was 29 and I was at home postpartum 8 days after having my baby, and I had a stroke.
In the United States annually, there are about 800,000 strokes. Of those, about 80% are what we call the ischemic type, and those are due to blockages of major or smaller arteries in the brain.
I had a severe hot flush inside and like a severe headache, and I had to release my headband at the moment, and then after that, the seizures began.
The remaining 20% of strokes are what we call the hemorrhagic strokes, and those are due to bleeding in the brain from causes such as high blood pressure or a ruptured aneurysm.
I was scared. So my thought initially was, okay, we're gonna call 911. Something was happening and I couldn't talk well, and they needed to hurry.
With a stroke, time is of essence. The faster a patient is treated, the better the outcome. For every minute that elapses during an acute stroke, millions of neurons are at risk for irreversible injury.
Stroke itself is the #1 cause of disability in America, and that's about quality of life. That's about waking up tomorrow and not being able to move your right arm or your right leg or both. There are a number of studies that show that people who suffer stroke oftentimes don't call 911 or wait hours before they do. And it is extremely important for the message to get out that it is okay to call 911 when you're feeling the symptoms of a stroke. The main signs of stroke that people should be looking for are those that follow the acronym FAST.
I don't know what's wrong with them.
Look at the face, the arms, their speech, and time.
Sir, what's going on? Can you hold both your arms up? We have a stroke alert here, guys. Let's let him go.
What do we got, Jay?
Got a left-sided weakness. Get a BGL right away.
We've worked very hard over the last few years in South Florida to educate the paramedics to call in a pre-hospital stroke alert with the stroke-like symptoms, any other pertinent medical history about the patient, and their estimated time of arrival.
We knew in order to be able to save brain, we had to save time. So we had to do things in parallel.
Memorial Regional, this is Rescue 7.
And so we instituted a parallel workflow within our hospital that took into account the information that the paramedics were giving us. Is he on any blood thinners? Something as simple as being able to perform a video evaluation on our smartphones is really helpful when a patient is in the ambulance coming to our facility, such that we are able to lay our eyes and ears on the patient while they're still in the ambulance, assess their stroke-like symptoms, in order to further guide the paramedics to recognize that this could be a severe stroke and also affect our activation of the cath lab as early as possible.
Stroke alert to the adult emergency room, station red.
As we're driving to the hospital in parallel
Dr. Cath, ET by trauma.
is activating their process. They're bringing their team in for the cath lab. They're getting all of their things lined up for us.
1, 2, 3.
They go straight to CT, where immediately we perform the scan of their brain
2 minutes and the scan will be done.
to determine what type of stroke they might be suffering, whether it's a bleed in the brain or a blockage of a major artery in the brain. In South Florida, there has been a proliferation of what we call comprehensive stroke centers. So it means that not only is the center capable of giving the clot-busting medication, the IVTPA, for minor strokes, what we call small vessel strokes, but also the more severe strokes due to major blockages of arteries in the brain, as well as bleeding in the brain. We have 24/7 neurosurgical and neurointerventional capabilities in the cath lab to treat the severe forms of strokes. Now our door-to-treatment times, once a patient arrives to the hospital, are a third of what they used to be, and that has allowed us to more consistently also get better outcomes for these patients.
Time is brain, and absolutely, with the standardization of protocols, with the collaborative effort between the hospital and the pre-hospital providers, we're seeing door-to-puncture times that have never been seen nationally, definitely not here in Broward County.
Was this a type of case?
Dr. Mehta was the doctor that responded to the call that saved my life. They did a procedure where they removed the clot. According to my doctor, who's my angel, he said that in the table I was already making movements.
To see a patient come in with complete paralysis of one side of their body, inability to talk, inability to understand what others might be saying to them. And within an hour of the treatment, to be able to see that they're now able to fully lift their arms and legs that were previously paralyzed, that's a feeling that's unmatched.
Thanks to him, my kids have a mom. My family has me.